Hello, sir. My name is Jeremy. I'm from respiratory. Nurse told me you're having a little trouble getting some of your secretions out, so I came to have a look at you. Could you tell me your last name and your birthday, please? Just gonna verify that on your wristband. Looks good. First thing I'm going to do is take a listen to your lungs here and see how they sound. Deep breaths for me, in and out through your mouth. Alright, you're sounding pretty crackly right now. Do you feel like you're having a hard time coughing stuff up? Yeah, okay. So what we're going to do is suction out some of those secretions. So that's going to mean I'm sticking a tube up your nose and down into your throat to suck out some of that gunk. It can be a little uncomfortable, but we'll try to make it as quick as we can. So first thing, put a little oxygen on you here. We'll just get a couple liters going. And I'm going to connect my suction tubing and set my pressure. New suction tubing. Get my suction on, and we're going to set to 150 millimeters of mercury. Include the end and check my pressure. And we're at 150, so that looks good. Also going to sit you up a little bit here and make it easier for the tube to find the right way down. And adjust your head, kind of stick your chin out a little bit. Perfect. I've got my suction kit, lubrication, and my sterile water. That up to get ready. Now we'll open my suction kit with sterile procedure. And pour in a little sterile water. Catheter there. I'm going to get my gloves on using the sterile technique. Only touching the inner portion of the cuff. And my sterile hand can grab the other one. I don't touch the other glove with that hand. Good. Now I have two sterile hands. Take my catheter out. Now I'm going to choose which hand is going to be my dirty hand. And I am going to make my right hand my dirty hand. So I'm going to take my lubrication, get that on the end of my tube. Sterile hand to work that around on the catheter a little bit. I'm going to take my catheter in my clean hand here, suction tubing in my dirty hand, make that connection. Okay, here we go. I'm going to move your cannula a little bit. Feel a little discomfort, but try to keep your head still. Advance our catheter. Okay, now I want you to take a deep breath in. Deep breath in, advance a little farther. Cough, 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 cough. Apply suction. Twisting the catheter as we come out. And we will replace our cannula. And we're going to flush with a little water in between passes. Okay, I think we've gotten a lot. We're going to take a look at our sputum that's coming out, analyze it for color, consistency, and amount. And we're going to also keep an eye on our patient, make sure they're not desaturating or bleeding too much during the process or after the process, and make sure their vitals come back to a normal, stable after we're done. And we can disconnect. And we'll throw away our kit, and we'll toss that into some biohazard waste if we have infectious waste in it, if our patient has a transmittable disease. Throw those away, and dump out my water and throw that away as well. Going to remove my gloves. Throw those. Yeah, I'm going to take another listen to you here. A couple more deep breaths. Yeah, that's sounding much, much better than you did before. Okay, I think we can take that oxygen off then. We'll shut that off. Shut off our suction. Alrighty, sir, I hope you have a good day. Decontaminate and document.